Hello, we want to thank each of you for volunteering to use your time and talents in the patient exit area at the Oklahoma Mission of Mercy. My name is Cheryl Bates.
And I am Rachel Longacre, and we are the co-leads for the patient exit area. We think you will find your patient exit experience very rewarding when you interact with the patients at what is their last stop in the OkMOM process. Most patients have spent many hours in line waiting to receive treatment by the time they make it to the patient exit area. Despite the long wait, the expressed appreciation and gratitude from patients will warm your heart.
The duties of the patient exit volunteers are numerous and include the following: verifying that the patient received medications from the pharmacy station if medication prescriptions were written, verifying that the student consent forms were completed accurately and includes the student name, institution, faculty signature, and the patient signature, verifying medical history paperwork. Be sure that the patient has signed the medical history form. Also, that there is a clinician name and signature, if possible, on the medical history form if treatment was provided. If they received a dental cleaning, make sure a dental hygienist signed that area as well. Complete the appropriate health department codes on the form. Only mark pregnancy if it is evident that the patient is pregnant. If the patient is not returning for care, give the patient their copy of the x-rays. They are found under the medical history paperwork on the clipboard. If the patient is returning for care, keep the patient's copies of the x-rays with the medical history paperwork. Staple them together and file in an alphabetical accordion file.
Completing the patient survey with the patient. Volunteers will need to ask the patient the survey questions to facilitate the process along. Most patients are extremely exhausted by the time they make it to patient exit. In the event that a patient does not speak English, a translator should be nearby to facilitate communication. Offering the patient a patient experience card for any additional comments that they would like to make. We request that volunteers let the patients themselves complete the patient experience card. Giving the adult patients only a goodie bag and thanking them for coming. Remember, if the patient is not returning for care, those x-rays should be placed in their goodie bag. If there are children toothbrushes available, give any child a toothbrush but not a goodie bag. They should have received these necessary supplies from the Pedo Family Clinic area. We ask that you stack those clipboards in a designated area for runners to take back to the triage area. If you are a Friday volunteer, please keep pins attached to the clipboard and place a new medical history on the clipboard. If you are a Saturday volunteer, once triage does not need any more clipboards, you can remove those pins and unused medical histories.
Some important things for volunteers to keep in mind in the patient exit area is to be alert of a possible medical emergency and where the first aid station is located. You can look for signs and symptoms of an emergency with a pale, white face or sweating. The patient exit area is a one-way road. Once the patient leaves, he or she cannot return to the treatment floor. If the patient has a complaint, we will refer them back to the patient advocates.
In the patient exit area, we are always working to make sure the final steps of the patient's experience is handled with the professional courtesy and sensitivity that every individual deserves. Again, we want to thank you for choosing to volunteer in the patient exit area, and we hope you enjoy your OkMOM experience. We look forward to seeing you very soon.